Check it out, Startup Nation. I know many of you are trying to improve your marketing performance, right? You have your business or your e-commerce store and you're trying to increase that brand awareness. No worries, I got you. You should listen to the brand new Keep Optimizing podcast. That's optimizing with an S and not a Z. It's a marketing podcast that will provide you with not only the latest tips and advice in the game, but also you will hear from experts in their field when it comes to email marketing, SEO, and more. This is a must-listen to podcast for my e-commerce entrepreneurs. It's hosted by Chloe Thomas, who is a 15-year marketing expert, best-selling author, and award-winning podcast host. It's already a top 20 marketing podcast in 7 countries. So clearly, you're going to get amazing value every episode. So as you can see, Startup Nation, you're in good hands with my girl CT. So listen and subscribe to the Keep Optimizing podcast on Apple Podcasts, Spotify, or anywhere you like to get your favorite podcast. You can also get more information at keepoptimizing.com. The link is there in the show notes.
It's time to be about that life, the startup life. Here's your host, Dominic Lawson.
All right, Startup Nation, so I hope you're ready to receive some value today. My name is Dominic Lawson, and this is The Startup Life, the show for entrepreneurs and career-minded professionals. You know, Startup Nation, one of the things I'm always fascinated when it comes to innovation is innovation in the healthcare space. You know, we have a lot of people who are looking for those solutions in that space, and our guest today is definitely on the forefront of doing just that. He's the founder and CEO of Tissium, a Paris-based company that is looking to revolutionize the medical technology used to support post-surgical tissue healing with a platform of novel devices. He is Christophe Bancel. CB, how's it going, my man?
I'm doing very well, thank you.
All righty. So let's just hop right into it. If you would, sir, just kind of share your origin story and your background a little bit, if you don't mind.
So I'm a native from south of France. I was born in south of France. Then I did my undergrad and grad school in Paris.
Okay.
My parents are a medical doctor and an engineer. So maybe this is why I kind of ended up in that field. And after studying a master of engineering in general engineering,
Gotcha.
I decided to subspecialize in molecular biology. And I guess this is when I ended up in working in the healthcare space. This is how it's all started.
Gotcha. Thank you for sharing that. You know, I'm always fascinated by the origin stories because it just goes to show how much our parents kind of play a role in what we kind of ultimately become. Kind of talk about your parents a little bit more, if you don't mind, Christophe.
So my mom is a medical doctor,
okay.
And I think that had an influence on this notion of caring and how you can help and impact the patient's life.
Mm-hmm.
This was present, I guess, in our discussion when I was younger.
Right.
And on the science side, I think the engineering mindset is something that I was raised with, and clearly something that I was able to enjoy and develop when I further studied.
Gotcha.
At the university.
For sure. Thank you for sharing that for sure. So let's kind of talk about your company a little bit, Tissium. Just kind of talk about how it came to be. And I know you do some, it's kind of collaboration with MIT a little bit. Kind of talk about that a little bit.
Yes. So Tissium is a company that was funded based on innovation from the MIT. A group at the MIT received an email from a professor from the Children's Hospital in Boston. Mm-hmm. And basically he was seeking for a new technology to be able to repair defect inside newborns' hearts.
Right.
And the challenge was, how can I close a defect in a beating heart on such a tiny heart? And the team at the MIT had designed a material that could have some properties to be able to fix and glue inside in a wet environment. And basically, we looked at the technology and we said, okay, if that technology would be able to deliver upon the promises, it could become transformational in the field. Because one of the challenges you have when you repair tissue, you want them to heal, but in many cases, the gesture to repair the tissue with a suture or with a staple is damaging the tissue before it can heal. So the idea was, would we be able with that polymer to connect back tissues together without damaging them so they could heal better or faster?
Gotcha. Thank you for sharing that. And I know you kind of started with like the kind of not necessarily replacement for like stitches and stuff like that, but that's kind of where it all started. But then you started to kind of build other products that kind of was an offshoot and had this portfolio of products. I guess what I want to ask you is, when you're scaling and you're thinking about the first product, is it a situation where you're thinking about trying to create other things that offshoot from that, or did it just kind of happen organically? Kind of talk about that process, Christophe.
That's a tricky,
Sure.
a great question. And that's something which is a bit tricky for the company and for an entrepreneur, because basically you need to start from something. You need to try to answer one question, one problem.
Right.
And in that case, you tend to be very specific and focused on what you need to achieve. But at the same time, in our case, the core of the technology is a new family of materials. So it can have multiple applications down the road. But you cannot start going in every direction. So at the beginning, what we did, we picked one specific application, which allowed us to really step by step construct the material to be a clinical grade product that could be used for patients. And at the same time, we ask ourselves, what would we need to do so that if we're eventually successful, the core of the technology could be used in other scenarios. So it was kind of short-term, highly rigorous process to deliver on our objectives. And at the same time, always put in perspective what would be the benefit to build a broader platform.
Gotcha. And thank you so much for answering that, because I know a lot of entrepreneurs, they kind of, they sometimes that we think, we have a successful product and we scale too fast and stuff like that into other things. And so I appreciate that approach you just kind of shared with us, Christophe, for sure. I want to ask you this because, you're in the medical field, and I imagine there's, when you're talking about new products and stuff like that, there's tons of regulation, tons of things you have to kind of navigate through. And as you scale globally, I guess I want to hear about the process of, having your product. I know you're based there in Paris and Europe and stuff like that. I guess I'm more curious about, like, how do you sell the product, like in the United States, or as opposed to Europe, as opposed to maybe Japan or something like that? Because I know you went to school in Tokyo. I guess I'm curious about how do you navigate through those different regulations based on the region you're in?
Yes, so that's a great question. My conviction is that today, when you develop a technology in the field, in the healthcare field, whether it's a drug or a medical device, you must see it from a global perspective. What I mean by that is the requirements, the work that is at stake is so big, and the regulations are such that you need to aim for a leverage down the road. So what we typically do is we tend to have a strategy that allows us to be able to comply to the different requirements from those geographies. So as of today, we have been mainly focusing on the requirements for Europe and the United States.
Right.
And clearly, the United States for us is a top priority. That being said, we design the technologies with the standards so that eventually down the road we would be able to also comply to regulation in Japan or in China or in the countries where we would eventually expand. But as an early investment, and the way we design our regulatory strategies, we always take into account the fact that these solutions have to be global solutions down the road. So we will apply to the specific geographies, obviously, but when we design the strategy, when we design the requirements of that the technology needs to substantiate. We always have in mind the fact that this product will eventually be a cross-regulation in multiple regulatory systems.
Gotcha. Thank you for sharing all of that, Christophe, for sure. Once again, Startup Nation, we're talking to Christophe Bancel, the founder and CEO of Tissium. And if you want to check out that website, Startup Nation, we have the link there in the show notes for easy access if you're listening to the replay on the podcast. So I want to kind of talk about, funding and fundraising and stuff like that. When you're in the healthcare space, and granted, you're bringing something new to the table and stuff like that, and it comes to fundraising, is it just as challenging as like fundraising any other type of technology outside of healthcare? Is it easier because it's healthcare, everybody needs this, of course we're going to throw you money? Kind of talk about that process, Christophe, if you don't mind.
Yes, in fact, I would struggle to have an opinion on other fields because I did spend most of my career in the healthcare field. Sure. But one reality is that in the healthcare space, because of regulation, because of the type of data and evidence you need to put together, and the standard of quality that are a necessity for your products, those processes and investments are quite long. So you need to be ready to embark on a long journey. So that's a piece. And usually it's synonymous to you will eventually need to raise a significant amount of money. The second component, which is quite important, I think, is science and biology takes time. In order for you to demonstrate, to validate, to prove, to ensure the level of a certain level of quality, it takes time because you have to do experiments and it takes a certain time to run those experiments. You need to validate the systems. And so you need to be ready for a long time frame. And because of the regulations that exist, the process can be, in some cases, long also. So I think what is important when you design and start a business in the healthcare field is to work with investors who know those constraints, because the time scale is quite important. And if your investors are not used to those dynamics, the complexity of a regulatory environment, the implications, the challenges when it comes to manufacturing and the quality that has to be associated to that, you may have a disconnection between what you need to deliver in order to have safe product for patients and also the timelines of investment from your investors. So making sure that my experience has been that it has been quite critical so far to be able to discuss with and engage with investors that knew the field, that knew what it takes to build such technologies, and that were willing to take the risk and add the patience to allow us to do what's right.
Gotcha. Thank you for sharing that. I want to ask a follow-up because you talked about, the manufacturing piece, because I know due to COVID, there's issues with supply chain and stuff like that. Have you been having those issues? If so, what have they looked like? How have you navigated them? Kind of talk about, running Tissium in the era of COVID a little bit.
Yeah, I mean, that has been a very challenging era for everyone, and also for all the people who have been affected directly with their families and loved ones. So sure. It has been a challenge for everyone across the globe. When it comes for us running a business, we did two things. First of all, when we entered the lockdown period in France, what we tried to do was reduce all unnecessary interactions between our employees. So we moved people to remote working, but in the manufacturing facility, we changed the shifts so that we had a minimal presence on site. And just to give you a sense, in our manufacturing facility, we are operating in clean room, and the people in the rooms are already fully equipped with those equipments that are required typically in sterile environments.
Mm-hmm.
But one thing we had some stock of equipment, and one thing we decided at the time was to send some of those stocks to the hospital nearby because they were struggling with access to those equipment. And after we were able to refurnish our stocks with suppliers once that crisis went away. But yes, we faced a situation where we had to reduce our activity in a way and also prioritize what we could do and could not do.
For sure, for sure. And you talked about, your teammates and the people that work there at Tissium. Kind of talk about, as the leader of Tissium and trying to keep morale high and to continue doing the work and staying on mission with the work you do at Tissium. Kind of talk about that culture building in the era of COVID a little bit as well, if you don't mind.
Yeah. Honestly, I don't have a great solution. What we tried to do,
sure.
At least at the early beginning, in the early days, was to be very transparent with the team,
Gotcha.
update them, share with them what we were aiming at, try to listen to them, their feedback, try to better understand if we could do things differently. Learn from them, from also their perspective. What we tried to do also was to really be very clear on what was the destination.
Gotcha.
And that what we had to face in those days was maybe a side journey, but the idea would be to eventually come back on track, which we are doing. But the way we did was make sure that all the employees felt as safe as possible.
Right.
So we could take that away as a burden, make sure that they would be able to take care of their loved ones, their kids, the people they have to take care of, while combining, making sure that the company was moving forward. I know that they did a lot of efforts during those periods, and it's still a bit the case now. To be honest, one of the challenges we have today is we can still we operate quite well, to be very frank with you, but all those pieces that make a company and allow you to foster the culture and make sure that people are always feel on the same boat and heading in the same direction, it's a bit more it's difficult today to put those things in place. I believe that a company is a group of people aiming in the same direction, and today we have not as many chances or occasion to bring those people together and feel that human interactions, as I could say. And I think that's missing. We are trying to find ways to do that in a more virtual manner, but it is not as effective as it could be, for sure.
Gotcha. Thank you for sharing that and being transparent, about that, because I know a lot of people are trying to figure it out. It's a new thing, so I definitely understand all of that for sure. I want to ask you this, because you talked about earlier about how you've been in the healthcare space for quite a while, and you got this amazing company, Tissium. I guess I'm curious, outside of what you guys do, what is something that you're excited about in the medical tech healthcare space outside of what you do? What are you excited about?
Oh, there are a lot of very exciting technologies. Sure. What I think has been what has impressed me in the last few years is how technology starts to integrate. What I mean by that, when I started my career in the late 90s, you had the field of biology, engineering. All those fields were somewhat distinct.
Right.
And in the recent years, in the last 10 or 15 years, you started to see a close integration between those different fields. And now when you speak about science, it's a field where everything comes together. And I think that will yield tremendous innovation and great technologies for patients. In the next 10 or 20 years, I think one field that will see tremendous changes, I believe and I hope, is the brain. For me, the 80s and 90s were a great tremendous time for everything related to the heart. And now the brain is still very unknown, but we are making huge progresses. So I think the integration of science, biology, molecular biology, and all that comes together will yield tremendous innovation for patients in that field.
Gotcha. And hoping to kind of collaborate even more with other people within the space?
Hopefully, our technology, as a company, our technology put us in a kind of unique situation. Right. What I mean by that is the heart of Tissium is a material, but it's not a product. A material is not a product. A material is what you can make, what you make of things. And in our case, we can make product that can be applied in very different tissues. Today, our polymers, you can use them as a glue, as an adhesive, if you want to fix or to connect back tissues together. But more recently, we were able, 2 or 3 years ago, to use the polymer as a resin for 3D implants. So basically now we are capable of 3D printing implants that can be inserted in different places in the body. So we can go one step beyond. And the way the technology was designed at the MIT, in the early days, they designed the polymer not to use it as a fixation technology, if I can say so, but more to release drugs inside the body. So we are capable to put drugs inside our polymers, and whether we use them for fixation or whether we use them for 3D printing implants, we can make those products active with a drug. And this could be placed in different locations, including the brain. So we don't see limitations from our technology on where it is used or how it is used. So we think there is tremendous opportunity. And currently we're working on 4 different programs, which happen to be in very different locations inside the body.
Got you. Thank you for sharing that. I wanted to ask that because we see a lot of people who, when they start on the entrepreneurial journey, they're always thinking about, I'm competing with this person who does something similar to me. But quite often and very recently, we've been seeing a lot of entrepreneurs who are interested in kind of, doing that. So I appreciate you sharing all of that for sure, Christophe.
Yes. So the way we look at it, the way you look at it, you will get 2 different answers. If you look at specific applications using our technology, yes, there are some competing techniques.
Of course,
because we are in the field of healthcare, and as you can imagine, the doctors, the surgeons, they are trying to help their patients. So you always have some solution.
Of course.
Is it the right solution? Is it the best solution? Can it be improved? Can it be done differently with a much better outcome? Sometimes the answer is yes. So today, you always have a competing solution or product, but maybe in some cases it's not effective. Just to give you an example, today we are designing one of our products is a system we are designing. It's the combination of an implant that we print, that we 3D print, and that we combine with some of our adhesive. And this implant allows us to reconnect peripheral nerve after a trauma, after an injury. So basically, instead of sewing the nerve back together with an implant or not, we are able to connect the nerve together so they can heal just with our system, inserting the nerves inside that chamber and connecting that chamber with our adhesive. So it's just to share with you that there are existing procedures or solutions, but we can bring them, we can live from them and go one step further.
All right, Startup Nation. So we're going to go ahead and take a quick break. We got to pay some bills. Once again, my name is Dominic Lawson, and you're listening to The Startup Life. Check it out, Startup Nation. I know many of you are trying to improve your marketing performance, right? You have your business or your e-commerce store and you're trying to increase that brand awareness. No worries, I got you. You should listen to the brand new Keep Optimizing podcast. That's optimizing with an S and not a Z. It's a marketing podcast that will provide you with not only the latest tips and advice in the game, but also you will hear from experts in their field when it comes to email marketing, SEO, and more. This is a must-listen-to podcast for my e-commerce entrepreneurs. It's hosted by Chloe Thomas, who is a 15-year marketing expert, best-selling author, and award-winning podcast host. It's already a top 20 marketing podcast in 7 countries. So clearly you're going to get amazing value every episode. So as you can see, Startup Nation, you're in good hands with my girl CT. So listen and subscribe to the Keep Optimizing podcast on Apple Podcasts, Spotify, or anywhere you like to get your favorite podcast. You can also get more information at keepoptimizing.com. The link is there in the show notes. Oralex powers this episode of The Startup Life. Startup Nation, as a podcaster, radio host, and business owner, I know a thing or two about the need for your message to come through clearly to your target audience. The last thing you want when trying to close a big deal over the phone or giving a sales presentation in your conference room is to have the person you are talking to be distracted by either the fact that you sound like you're in a warehouse or an outside noise like a fire truck. Trust me, Startup Nation, I know this all too well from experience. And that is why Oralex has your back. Oralex Acoustics creates professionally tested products that you can trust in a commercial space or at home. Better office acoustics improves intelligibility when video conferencing or generic conversation, reduces stress, and helps build a proactive work atmosphere. From a home studio for my content creators to your office space downtown, your gear performs better in an acoustically treated room. Trust me, you are in good hands with Oralex as they are the #1 brand in acoustics, providing trusted solutions for over 40 years. Also, you can download the Oralex Acoustic Treatment mobile app in the Apple or Google Play Store to give you specifically designed and instantaneous recommendations for various room types. Go to Oralex.com and use the promo code STARTUP in all caps for 10% off your entire order. The link is there in the show notes if you are listening to the replay on the podcast. So if you are ready to stop sounding like you're having a sales meeting in a sports arena, go with Oralex. Professional audio made simple. Tresta powers this episode of The Startup Life. Okay, Startup Nation, I want to talk to you about our sponsor, Tresta. Tresta is an app for iPhone and Android that lets you do business calling and texting from anywhere. I know so many entrepreneurs that are still using their personal phone number for business calls. It can get complicated drawing the line between your personal and professional life. Startup Nation, this is the best business phone app out there. Whether you just need a business phone number or if your team is ready for a complete business phone system, Tresta is totally flexible and can grow with your business. And it's all unlimited calling, texting, and all of the powerful call management features like auto attendance, call recording, user groups, and more for just $15 per user per month. With Tresta, there's no contract, and you don't need any special hardware, just your smartphone you're already using. Tresta is easy to configure, so you can set everything up yourself, all online, avoiding all the hassle and high overhead costs of setting up a traditional business phone system, which is important because as entrepreneurs, we are always trying to cut cost and time. They're offering a 30-day free trial so you can see if Tresta's virtual phone system is right for you. Communicate smarter and more efficiently with Tresta. Start now at Tresta.com/startuplife. That's Tresta.com/startuplife. The link is there in the show notes if you're listening on the podcast. Tresta, business communication simplified. All right, Startup Nation, welcome back as we continue our conversation with today's guest here on The Startup Life. For sure. Thank you for sharing that. Startup Nation, once again, we're actually wrapping up with Christophe Bancel, the founder and CEO of Tissium. And once again, if you want to check out that website, we have a link there in the show notes for easy access if you're listening to the replay on the podcast. Christophe, I want to ask you this. I just want to kind of get your sense of, I'm here in the States and I know Tissium is based there in Paris, in the heart of Europe. Kind of share with me the entrepreneurial culture there in Paris and greater Europe, if you don't mind. What's your commentary on that?